5 seconds, okay.
Start and it is 5 seconds.
Okay, starting the program. Hi, good afternoon all. Today is the 3rd March, which is being conducted as an event of World Hearing Day by WHO. WHO organizes an event every year on this day to make a special note on event. Sure.
Start చేయించారా స్టార్ట్ చేయండి సార్ ఓకే సో చేసింది సార్
Hi, sorry. Good afternoon now. March 3rd is being conducted as a World Hearing Day by WHO to make aware of how to prevent deafness and hearing loss in general public and thereby increasing the awareness of importance of hearing for every individual. This is the most important hearing is a most special sense whose loss cannot be bridged with other things. There are many important things which you can prevent, like by following certain things. So WHO organizes every year yeah, on March 3rd as this day an event which where it promotes this event with flyers, banners, presentations all around the world and makes everyone to participate in this event. By doing so, in general, it increases the awareness among the public as well as the community, and then the quality of life can be increased. Hearing is such an important mechanism in the human body that it actually it bridges between the environment and the person. So that is the most important thing. Unlike blindness, which could be perceived when somebody closes their eye, they can see that how the blind can perceive the world. But unlike blindness, hearing loss cannot be duplicated by even after closing tightly the ears. You are still attached with the environment, so it is a completely unknown suffering of a person, which only with only with empathy one can understand the problem of hearing loss. So every year WHO has a theme for this, and this year the theme has been ear and hearing care for all, and let's make it a reality. So how do you do this? The primary aim of WHO is that the integration of hearing ear checkup in the primary health care, thereby the universal health universal health coverage it becomes a principal component in the universal health coverage. So as such, the community health also increases, like how we are taking care of blindness, the hearing loss also need to be given so much of importance. So they are the most common problems encountered in the community, and the most important aspect is that 60% of these problems can be identified at the earliest, and then the treatment also can be given. So at the primary healthcare centers, the healthcare providers as well as the physicians are trained in such a manner so that they identify these problems, and then they give the primary treatment over there. And after that, if something else need to be done, they can be referred to as specialist surgeons or ENT physicians in the tertiary care. So to identify the patient is the first thing which everybody needs to do, and then once the problem is identified, if it can be cured, it can be cured. Otherwise, it can be sent to the higher center for now. So there is a manual which the WHO releases basing on this theme, So the primary ear and hearing care training, it's called the primary ear and hearing care manual, training manual. Okay, so this is to draw attention of decision makers in the government and then civil society towards the WHO's recommendations regarding integration of ear and hearing care in the primary health centers. Encourage governments and other voluntary bodies to get trained in this process, and also call attention of primary healthcare providers towards the needs of the people with the hearing loss and ear disease. Inform people about the importance of ear and hearing care, encourage them to to seek services. And what is the difference between if you go to the data, it is staggering to note that over 1.5 billion people globally live with hearing loss. This number could rise to 2.5 billion by the year 2050. So that is this is no exaggeration. This has been collected by WHO basing on certain parameters. So this is this is a very alarming. One has to deal this at this stage, and you cannot have no double, almost doubling the amount of people with hearing loss now to down the lane over 30 years. So we need to take steps for that. And more than 1 billion young people are at a higher risk of hearing loss due to their recreational exposure to loud noise. That is one more aspect one has to keep in mind. And then $980 billion US dollars is the overall annual cost of unaddressed hearing loss globally. So by addressing this issue, it becomes so much economical. And then 1 in 4 people are projected to have some sort of hearing problem by the year 2050 by WHO. So again, alarming data which need to have the attention need to be prioritized. So the number of people living with unaddressed hearing loss and ear disease is unacceptable, and then timely action is needed to prevent this much of loss. And investing in cost-effective interventions will benefit people with hearing loss and bring financial gains to the society. So, which is very important. Countries must integrate people-centered ear and hearing loss, hearing care within national health plans for universal health coverage. This is is an important message to the government to have in general the public in general an increase in the public health status. So integrate people-centered ear and hearing care within national health plans for universal health coverage is a call to nation. So what is what now we talk about the clinical nature, and then how to prevent deafness or how to treat deafness or a hearing loss. So let us talk about more about what is deafness and what is hearing loss. Hearing loss is people can still hear a little bit and then they communicate with their own language. So the through verbally. So that is in. Whereas deafness is a profound loss of hearing, whereby people cannot hear anything, and then generally, if when it is from birth, they do have the lip reading, and then they develop sign language. So deaf people are when the deafness is from childhood, it is difficult to treat because they don't develop speech unless you have an input of sound. The output of speech will not come. So the deaf are generally since childhood they are dumb. So there are deaf people even after developing speech. There are people and there is treatment for that, which people need to seek the services. And first of all, they should be aware of these services which are available. So when we talk about deafness, what are the kind of deafness you have? You have what is called a conductive loss and as well as a sensory hearing loss. So conductive loss is the sound which propagates from the atmosphere to the eardrum and from there to the inner ear is the conduction mechanism, which can be at lot of stages can be prevented as well as treated. The sensory neural loss beyond in the inner ear is which is a condition which can happen during birth or after birth with exposure to loud sounds. And what causes the hearing loss and deafness? We'll talk a little bit about it. There are many conditions when we diagnose and then how to diagnose hearing loss in the childhood itself, and when the baby is born, there are a number of tests, and then also there is a treatment. We'll talk more on that a bit stage by stage. So now coming to the point of hearing loss in case of children. Children can be born with hearing loss when the parents are with consanguinity, when there are hereditary conditions, or if the in the womb itself, if the infant in the uterus itself, if the mother has any virus infection that can damage the hearing nerve, as well as when there are syndromes which are associated developmental anomalies due to hereditary reasons. If they are there, then also the hearing problem can come. And then when you come to adults, hearing loss can be because of infections, or it can be because of trauma. It can be a noise trauma, or physical trauma, or it can also can be because of any tumors, or it also can be some hereditary conditions like atherosclerosis. So to diagnose what is causing is that in the primary healthcare center, if somebody sees in adults, it also can be a simple reason of somebody has a wax or some foreign body which is obstructing the conduction of sound, which can be treated very easily in the primary healthcare center. Or any infection which it is there can be identified in the beginning and then can be treated if it is an active state with antibiotics or anything, and then they can be sent to the higher centers like a tertiary care hospital, where the treatment can be given with surgical application. So also the hearing loss can happen once somebody is taking medicines which are autotoxic. That is, the medicines can damage the hearing mechanism. So those medicines need to be stopped immediately, or the doctor need to be told when somebody has only one ear which is functional and the other ear is not functional. So doctor should be given prior information regarding the loss of one ear, so that the other ear could be prevented, or a prolonged use of medicines which are autotoxic need to be avoided by the general practitioners as well as the specialists. So these are the things which can happen, which can cause hearing loss. Also, word about noise pollution. There is an increase with urbanization. There is so much of sound that is being produced by vehicles, vehicle engines, as well as honking. Also, like industrial pollution, or any civil construction where the noise level is so high, or recreational activities like music systems. See, all these activities, more urbanized, you see in the urban society, are adding problems to the already existing conditions. So anything which is above 60 decibels is a noise, and which can harm the ear. So when we are talking, then the sound is measured in decibel units. So we talk in those units for the time being. So in a 60 decibel loss, it is the normal conversation which can happen, or when it is 80, 85, it is very noisy, and also it can damage the ears. So there are high volume like anything like a bomb blast, anything can go up to 130 decibels, which is really, it damages the ear. So all these noise producing areas need to be curtailed, or one has to prevent their ears with mufflers or things like that in occupational exposure. So these aspects do reduce the incidence of hearing, thereby we can promote a better society in terms of. So what actually happens with the hearing loss is that when you are getting you're not in contact with the environment or the person surrounding you, you become dull. So the mind also becomes dull, and then there are behavioral abnormalities. So loud noise also causes irritation to the person, lack of sleep, hypertension it can cause. So the noise level need to be reduced at any cost for the good health of a community. So these aspects need to be taken care. And then there is a physical trauma, like somebody slapping someone, or putting an earbud into the ear just to clean it. So there are mechanisms of preventing the damage by the design of the ear itself, where it has its angulation in the canal. But there are people who come to me who saying that his earbud is not going straight into the ear, and then it is hitting something hard. So when you can see that with the angulation, at the angulation level, they are pushing the earbud against the bone, which actually prevents it from the drum from getting harmed. So stop it there. Do not use the earbuds so frequently, and also be gentle. The earbud end need to be fluffy, so that it only absorbs the water or whatever the moisture that is there, but not. It is earbud is not to clean wax. Cleaning wax has its own mechanism of getting cleared. If it is not getting cleared, you need to attend to a physician to clear under vision. So you just cannot treat and then see this as a normal thing. It cannot be a habitual aspect, because once the ear is damaged, the hearing mechanism, we do repair, but repair is not equivalent to the original design. So always remember that it can be a near normal, but it is not the normal as has been given by nature. So keep those in mind. We spoke about the causes of hearing loss, and then how to diagnose this. So you can diagnose this by various means. Right from birth, there are something called autoacoustic emission machine, whereby by keeping a probe into the child's ear, one can see the waves. If they are present, we know that the ear is functioning. Or when the child doesn't startle with a loud sound, or they don't say "Mama, Papa" by the ear of one ear, please be alarmed that something is wrong with hearing. So the first thing is that be aware that something is wrong with hearing. Once you are aware, then you'll start attending to the problem. So once you find that the child is not turning the head towards the sound side, where the sound is produced towards that side, then approach a doctor, get it checked up, and then if it is done in the earliest, if it is detected at the earliest, one can do a cochlear implant surgery, whereby you put an electrode into the inner ear, and then the hearing mechanism can be brought back to normalcy. So the child develops normal, and then he or she will develop the speech, and then they can be in the society as normal persons, as everyone is. There are people. When I started my career, I conducted camps, and then I have identified people who were deaf at that time. They were 5 year old. Now they have become teenagers, and they become elderly. They did not get the treatment that was told, and then they became deaf and dumb. Now you cannot do anything, because whatever you do at this stage, we cannot have the recovery of speech for that person, because the neurons which develop this hearing and then speech mechanism become plastic over the age of 5 to 7 years. So doing anything childhood deafness before 5 years is the best, and before 3 years is the best. But you can still do it till 7 years or below that. So make sure that if you find anybody who is not responding, any child who is not responding, please refer them to an ENT surgeon. The other aspect is that how you recognize in adults. See, I always tell patients that you need to stage the hearing loss. So one can stage the hearing loss. So what happens in that is that, first of all, nobody recognizes that they have a hearing problem. So the first thing you notice is that they'll be increasing the TV volume than others, around 20% more, which is a noise to others, but for them it is normal. They don't recognize that, and somebody has to speak to them. They'll be talking a bit loudly to them, and then they think that they get irritated when somebody speaks loudly to the other person. So next comes that the patient, these people will not tolerate this, and then they stop talking to the suffering person. So slowly they get detached with the with the relatives or the people around them, and then later on they think that somebody is murmuring against them. So these are the mental stages, like, transforms from being ignorant to doubting people, and then getting calm. They become calm after some time because nobody speaks to them, and they don't also hear some sounds like birds chirping, or the leaves, the sounds of the leaves, or the nature sounds. And then they are cut off from the society so slowly, their brain stops. So the activity of the brain also slows down, and then they become dull, and then they'll have dementia. They'll be forgetting things, and they'll not be active enough. So try to identify these things at the earliest, provide them some hearing aid. If not surgeries, if there is an infection, you can treat with surgery, or if there is something like autosclerosis, any surgery can is possible. Or somebody who is exposed to loud noises, the hearing loss can be prevented by avoiding those situations, or by identifying the elderly, giving them a hearing aid. There are so many good hearing aids that are available now, which are also not seen. There are intracanalic, which where you can place the hearing aid into the ear canal, so that as and when required you can take it out. As and when required you can use it, or later on you can take it out while sleeping or taking bath or anything like that. And then they are rechargeable. They are also getting connected with the Bluetooth to your phone, so that you can speak to Bluetooth with the phone. So there are electronics have developed so good that the life has become easy. Just imagine that you don't hear, and then you can't talk over telephone with your friends of late. This has become the norm of communicating with everyone. So you need to have a good hearing ear. And the other thing is that exposure to loud noises also includes these earphones. The one where the high frequency is the most dominating feature of a earphone, which directly conducts the sounds to the eardrum, and then thereby there is a loss of cells in the inner ear, which is not advocated. So you have to cut down your sound volume just to take care of your ear. The drum also cannot move at that high frequency range. It also has to move. When it moves so violently, then there is a lot of disruption in the inner ear. So the cell phone usage, you need to be careful. One need to be careful about that. And also by using mufflers, one can prevent a lot of hearing. So with that, like no other thing, what I told is that about the drugs, take care of taking prolonged medications like tuberculosis, or anything like some antibiotics, or anti-malarials, which are injectables. So be careful while using these, and then keep a check on that on the hearing, and keep asking the patient how their hearing is. Also, patient also need to be aware of these things and then recognize it at the earliest. So recognition is the one best thing where you can avoid, as I said that earlier, 60% of these problems are treatable. So please avail the services that are there everywhere, whether identification at the primary level or at the secondary or the tertiary level hospitals. You have a number of good gadgets nowadays. You have lasers, you have microscopes, endoscopes. We are dealing with diseases like somebody has a ear infection which has spread to the brain, and that has been drained and the ear is clean, so that the person is living almost normal. There are So make use of all these facilities which are available in all tertiary hospitals. Even at KIMS Icon Hospital, we have very good facilities like this. So make use of these things. So hearing is in a special sense which cannot be ignored, and then be aware of its effects, and then you get your diagnosis right, get it tested, get the treatment that is there. And then here I quote that Helen Keller famously said, blindness cuts off from things, but deafness cuts off from people. So hearing loss limits one from interacting with others, so impacts the ability to participate in social and workplace interactions. It limits learning and professional activities. In children, it interferes with learning. In older people, deafness is linked to cognitive decline, increasing the risk of depression and dementia. So, so this is let us take it very seriously, and then improve the quality of life of every individuals in the society, and then let them what the nature has given, let them perceive it not only with the eyes, also with ears. So makes you in touch, and makes you in touch with the nature. That is very important. So with this, I conclude my talk. And any doubts for anyone are welcome. I I welcome that. So there is a question from Allu Arjun Fans Club. So does hearing aid is the only option for hearing loss? As I said, that hearing aid is one mechanism for hearing loss. It depends when somebody who is old, who cannot undergo surgery, which if it is surgically treatable, if they are not fit for surgery, then hearing aid is nothing but it's like when you use spectacles when you have loss of vision. So are we not using spectacles? It only amplifies the sound and then gives it to the ear. So it is like any other supplementary thing, like like a spectacles which magnifies the vision. So the same way, the hearing aid also helps in the same manner, but everything depends on the cause. If it is a presbyosis, what we call the old age deafness, then hearing aid is one of the modes of getting the hearing back. So the simplest, you can wear and then take it out. Even now, after from 1996, I am in this field. But even now, when I say somebody to wear a hearing aid, they feel shy. I do not know why it is happening in the society. Please shed this fear of somebody is commenting on you. It is not. You are wearing Bluetooth over the ear with style, or the latest wireless earphones over the ear. you feel that as style. So even this also can be projected as a style if somebody feels it as a stigma. It is not. He wearing hearing aid is not at all a stigma. It only improves your quality of life, so you will have a better life. So if that is the solution, please do use it. Do not say no to it. Hope I'm clear. Is hearing loss related to other health problems? Yeah, any when you have any microvascular
Still working?
sorry for that.
Sorry, I'm having trouble with the connection. Please try again.
Yeah, sorry for that. So any disease which decreases the blood supply to the inner ear. So the hair cells, we have conductive hair cells, which also will go down in their number. So the hearing loss can happen. So any other disease like cardiovascular disease or anything can have a hearing defect. Some fevers, viral fevers can affect the hearing. So that's the thing. Any infections also can reduce the hearing. Yeah, the most common cause is occupational exposure to sounds. That is the most common this thing. Loud sounds environmental or any occupation. So one has to see that. As I said, that 60% of problems are preventable, which can be prevented, and then next comes the infections. So noise exposure is the primary thing which one has to prevent at any cost. Yeah, as I said that what are all the warning signs of hearing loss? As I told you, the warning signs are the first of all, you don't recognize that there is a hearing loss because you feel it is okay to have a higher volume, but only the surrounding people should be able to tell you about that you are on a higher sound because for you it is normal, but for them it is at a higher volume. So that thing you have to realize at the earliest that something is wrong with my ears. So that is the first warning sign for an adult, or if it is a child, when they don't turn their head when there is a loud sound or anything like you clap loudly, when they're not turning, they're not startling or anything like that, then yeah, that is the first sign in a child. So one has to be attentive about these changes. Thank you. I think I'm clear with all the doubts what you have. Oh, right. Thank you. Happy World Hearing Day for you too. Thank you very much. Any more questions? Okay, I'm signing off. Thank you all for your patience listening. Thank you.